Good afternoon, everyone. Good morning, good evening. I understand we're webcast live, so this will be both available now and on YouTube. Welcome to the World Health Summit session here on the future of quality health information, indicators, economic value, and global developments. I'll be chairing and moderating the session, and these are the people at the table. I'm Scott Ratson. I'm based at City University of New York's Graduate School of Public Health and Health Policy, and co-chairing this Nature Medicine Commission on Quality Health Information for All. I'll just introduce people from right to left, and then we're very happy to have Catherine Kluver-Asbrook that will be giving opening remarks, and we'll go right into it. So on our far right is Carolina Batista. She's one of the co-chairs of the commission and will be speaking later. Eric Sutherland from the OECD. Rebecca Evich from University of Alabama, College of Communication and Information Sciences. Ben Johnson, the chief editor of Nature Health. Alexandra Kuzmanovic from the World Health Organization Leadership Unit in the Department of Communication. And Larry Gostin, who many of you know from Georgetown O'Neill Institute for National and Global Health Law. But without further ado, I'd like to turn this over to the other sponsor of this event, notwithstanding the great work that we have been able to accomplish just last week at the first inaugural meeting of the Nature Medicine Commission here in Berlin at the Bertelsmann Stiftung headquarters, if I could say that, of the foundation. And it was just a wonderful event that some of our people will refer to in our discussion. But with that, I'd like to again turn it over to Catherine. Thanks.
Well, ladies and gentlemen, good afternoon on behalf of the Bertelsmann Stiftung, who is so pleased to co-sponsor this event and this gathering, and formidably this fundamental conversation, which I think will be of great value to all of us. My name is Catherine Kluver-Asbrook. I'm Executive Vice President of the Foundation. And if you don't know us, if you're German, you do, undoubtedly, because we as a foundation are truly dedicated to the idea of human thriving across all of our work, whether it's in education, whether it's on sustainable cities, sustainable environments, sustainable economies, but above all for this gathering, of course, in supporting health equity in a spirit of solidarity, where we center our thinking and research on the patient and her needs in a changing digital environment. So we're above all human-centered at every aspect of our work, which is why our partnership with Nature Medicine, with the Nature Medicine Commission, has been so important to us. You heard they gathered at our offices just a few days ago to really emphasize the idea of quality health information for all. We published a new survey where we looked specifically at the situation in Germany, and this will be unsurprising to you because you'll find this in many international contexts, that 93% of Germans feel that the quality and security of information is vital when they're accessing information online with respect to their own health, the health of their near and dear ones. 87% do access health information online, alongside consulting their healthcare professionals, but sometimes without. And that's what makes that moment so critical. And women, perhaps unsurprisingly, because we're always the information seekers, 91% seek healthcare information online. So as geopolitical shifts impact healthcare provision globally, the equality of access, the kind of access, having access to data, and the interpretation of that data as it relates to factual, data-centered core of what that information is to represent effectively the best of available science that is vetted, that is useful, that is patient-oriented, that truly becomes a matter of life and death. Healthcare calamities, as I don't have to tell this audience, they do not stop at our borders, nor are they an exclusive domain of certain populations. In fact, the reverse is true. So those that care for patients need similarly vetted, accessible, quick information that they can trust, which is why we're also so engaged at Bertelsmann Stiftung in the intergenerational aspects of providing quality healthcare information, particularly online, because what is true of all of us is thus most triply true of the next generation. That is where the next generation goes to seek information and to find reliable and trustworthy access, which is why we have also stepped in and supported and are supporting the WHO Youth Council. And so supporting and amplifying the work of the Nature Health Commission, with which we're developing InfoCure. I'll talk a little bit about that as we wrap this session. A certification process for trustworthy providers of digital health information is of absolute priority to our work. And that's why we want to anchor this conversation, but every other conversation from here on out, in the principle of trust. Trust remains our most valuable commodity in this time of political polarization and divisiveness. Medical professionals, many of you who are in the room, take an oath to protect human life. And increasingly, as major powers redefine, painfully to me, and I think many of you, what compassion and care in our global community actually is, this commitment extends more deeply to actors who can provide the platforms for essential gatherings like this one today. We at Bertelsmann Stiftung feel compelled to sustain this commitment in the spirit of deepening trust, which is why we're all here together, advancing the value of global scientific achievement in our pluralistic societies, and accelerating health information integrity to empower all of our societies in a spirit of global solidarity. So with that, I'm looking forward to this discussion. You'll hear from me a little bit later, but I look forward to engaging in this conversation with you. Thank you very much, Scott.
Thank you, Catherine, for just a great approach of setting the stage and the scene of what we're hoping to do here, not only with our commission discussion today, but going forward. And it was a great honor to be here in Berlin to have the inaugural meeting of the commission. So I'm going to offer a couple of slides, and then the people that I've introduced will have the opportunity first to hear from Ben Johnson, who'll do the largest setup of really what the Nature Medicine Commission is about, and also introduce the new publication. And then we'll have the opportunity, hopefully, for a more interactive discussion amongst panelists. And then, as Catherine said, at the end, we will come back and have some other wrap-up questions and potentially have questions from the audience. But with the amount of time allotted, most likely it's, so you know, we're going to be able to just speak amongst ourselves. But yet, for those of you online, I understand that there are ways to communicate with us, and we're not closing by any means what's happening here today. So just really two slides I'll mention. We are the first commission ever established by the Nature portfolio, and we're very proud to say that in being supported by Nature Medicine. And as mentioned here, it's editorial independent, expert-led, international, externally funded, meaning cost neutral from a publishing standpoint, science-driven, and designed to engage multiple stakeholders and influence policy and decision makers. And for those of you who are wondering about rankings, not that impact or readership always matters, because it's also the power of the pen and what is being written and the quality of it. Nature does both of those, and Nature Medicine ranks third amongst the primary research journals globally, ahead of Science, the New England Journal of Medicine, and The Lancet. And we announced our Nature Medicine Commission in January 22nd. This was online. You can still find this. And just I'll mention the four goals and then turn it over to Ben. One, to quantify the impact of gaps in access to quality health information on individual health as well as national economic growth. To promote broader access to accurate, reliable health information in the digital era. To improve public health by advancing health literacy and information equity for all people. And then finally, to affirm the importance of health communication as a distinct discipline to advance health. So we have short, medium, long-term goals and ideas that we hope to garner from not only people who are here today, but in listening, data-driven, science-driven, evidence-based approach. So with that, I'm going to turn it over to Dr. Johnson, who will lead us through the scope of the portfolio.
Thank you. Thank you, Dr. Ratson, Scott. Before I start, we're delighted to be holding a hybrid session and that people are online, but I want to reflect on the value of in-person meetings, because you might think, why do we bother in the modern world all traveling over to Berlin to have some lovely food and chat to each other when it could all just be done virtually on the internet? Well, this whole commission came from an in-person meeting. So I was at the Consortium of Universities for Global Health meeting in Los Angeles in March 2024, so just about 18 months ago, attending a session on quality health information with Scott and Ken Rabin, who's also in the audience, on the panel. And I was sat there, we just had some internal discussions, which I'll talk you through, at the Nature portfolio about whether we should be launching commissions to influence evidence-based policy. And I was sat in the audience thinking, this could be quite a good topic for a commission, quality health information. This feels quite meaty. So I chatted with Scott and Ken, and a year and a half later, we were at the Bertelsmann Stiftung last week, meeting with German ministers. We're now here with all of you in a full room. So anything is possible after you attend an in-person conference. And a word of praise for in-person meetings. Why are we launching commissions at the Nature portfolio, and why this commission? Well, many of the grand challenges facing society today affect health. This is from the World Economic Forum. On the left is the short-term challenges, and right at the top is misinformation and disinformation. But many of these affect health: extreme weather events, armed conflict, societal polarization, pollution. And so if a policymaker is trying to develop policies that will tackle these, what is the evidence that they have? Do they have the best available evidence to tackle these issues? Should they be interested in evidence-based policy? But information is also a determinant of health. And medical journals have a really unique role here. Health information informs clinical practice, healthcare guidelines, and public policy. But also your ability to access information, day-to-day information about what food to eat, about what might be safe, what might be dangerous in your environment, or if you're pregnant. Your ability to access this information affects health-seeking behaviour and underpins the social determinants of health. And this is an article, an opinion piece we published from authors at YouTube Health, who are very aware that if a video is created where the person creating it has no evidence whatsoever, it will do very well. Whereas if the creator has bags of evidence, is a real expert, it tends to do less well. And this is a real challenge facing society. Misinformation and disinformation about health is absolutely widespread. I think we all know that. But health disinformation is nothing new. It's as old as health, indeed. This is a cartoon from 1851 by James Gilray, who was an influencer of the age, a content creator of his age. And indeed, this was reproduced in pamphlets, which were the disruptor of their age, that were distributed on the streets of London very cheap. This is a lady in the middle getting the smallpox vaccine, and the people around her who received the vaccine are sprouting cow heads, cow horns. And this is a humorous cartoon, but this reflected real concerns that people had. These people were not anti-science or anti-vaccine. This was a vaccine produced in cows. Vaccine derives from vacca, the Latin for cow. We still use this word today, at least in most languages, in European languages. So we still use this word today, and I think we must remember that there are real concerns that people have, and there is often a lack of information, quality information. And it was around this time that a couple of journals launched. Nature in 1869 and The Lancet, a bit older than us, in 1823. And academic journals, at least these two, were launched not just for scientists, but to educate the public. And that's a role we continue to this day. Indeed, if you look at the mission statement of Nature from 1869, you may think Nature is a magazine for scientists. Well, we didn't really publish anything you would consider a research article for about 30 years. The main goal was to place before the general public the results of scientific work. And secondly, to aid scientists themselves, although the term scientist didn't exist then, and the term scientist was debated in the pages of Nature very controversially at the time. So we take very seriously this role we have in communicating science to the general public. And this is kind of the ideal situation where research informs policy and policy informs practice, but there is often a gulf between scientific research and health policy and health practice. Practitioners and policymakers don't necessarily read The Lancet or Nature or the other wonderful journals that are available. And so we need to find ways of making this evidence available to them to inform evidence-based policy. So that's partly why we're launching these commissions to inform policy, and we believe that we're uniquely placed to do this because we are a multidisciplinary portfolio of journals, that we launch a few every year. So Nature, the mothership on the right, but we have journals from health and medicine through to climate change and sustainability. So all areas across science, technology, and medicine, which I think makes us uniquely placed to tackle these interdisciplinary challenges. You know, what is the role for AI in planetary health, for example, or health information, which includes not just the biomedical sciences, but the social sciences, behavioral sciences. A plug for the new journal. So I spent 4 very happy years at Nature Medicine, and then we decided to launch a new journal of public and global health. You may not have heard of us, and I will forgive you if you haven't, because we haven't published anything yet. But we will publish in January our launch issue. We've had, I'm being videoed, so I won't say how many submissions. We've had a lot of submissions. We've had strong interest from the community, which I think reflects the need for evidence, high quality evidence in public and global health. And I put this here not just to advertise the journal, but because the discussions we've had internally that led to the launch of the commissions, which is about evidence-based policy, are the same discussions that led us to launching Nature Health, because we were aware that we were not sufficiently well equipped to publish the research that was tackling public and global health challenges, which includes environmental health and digital health, 2 key areas for us. So the commissions, the aim is to synthesize fresh evidence to inform policy. They are interdisciplinary and they are international, and you'll hear from our distinguished panelists just how interdisciplinary they are, including academics, policymakers, and practitioners. And a kind of threefold goal is describing the scale of the problem, which is often not known, and it's not, we'll hear a bit more about this today, but actually what is the scale of the problem? What is the cost of lack of quality health information has actually proved to be one of our biggest challenges so far. What's the impact? And then recommending solutions which should be evidence-based, workable, scalable, and sustainable. So that's the goal. I'm sure you'll all wish us luck on this very challenging but important task. And I'm handing over back to Scott, I think.
Great. Thank you, Ben. And the subhead of our commission title is Reinventing Health Communication for the Digital Era. So I'm going to go through just a couple of slides. I've also been editing the Journal of Health Communication now for 30 years. Now when I see the 19th century launches of Lancet and Nature, it gets me to think where we may be going with the field of health communication. And then our 4th decade, we are talking about reinventing it because the world certainly has changed from where we were in the 1990s. We're happy that we have 4 global health leaders. All of us are here. Heidi may be in and out in her multiple roles, but we have 3 of our co-chairs here on the commission, and they'll talk, as we said, later. And we have 3 institutions that are co-secretariats. And these institutions are engaged in different ways with a School of Public Health, a School of Communication and Information Sciences, and an Institute for Tropical Medicine that largely is focused on infectious disease and work over the years in lower and middle income countries. We're going to streamline activities, so some of this will be both hosting events, for example, and also engaging in research. So the CUNY Graduate School of Public Health and Health Policy, through the gracious work of our dean, Ayman Al-Mohandes, who was here, helped support a global survey of 30 countries that we have presented some preliminary data to the commission and will be available later, as it not only informs the commission, but the broader world and literature. And we also have other pieces with the Institute of Tropical Medicine engaged in building a network of institution departments, and the College of Communication and Information Sciences, also with the computing and brings the social and behavioral sciences and the communication sciences with us. The first order of the broad piece that will come out is affirming the practice of health communication as a distinct discipline. There's a number of different, not only competency models and other pieces that are out there, but our job is not to come up with new pieces, but to help advance the field and also elicit the need for this area. And we'll hear a little bit more from that from some of our commissioners that may be nodding at this point. And working for the second part in italicized, speaking out for science, that we're in a very interesting political environment, if I can say that, and in a slide or two I'll show exactly how that is challenging the work that we do. Our group got together, and for the first time, we not only looked at some of the data and some scoping reviews that we'll hear a little bit about, but we also came up with a working definition of what is quality health information. And believe it or not, if you do a search, you can't find it. And this will probably be there sometime soon once we publish it. But again, it's a working definition that we know each of these have potential measures, potential indicators, potential ways that they can move in either direction, because we want high quality information at the end of the day. And that means it needs to be scientifically sound, broadly speaking of sciences, as we've heard already, accessible to people, the for all in our title, clear, not only whether it's visually, whether it's written, whether it's whatever form of communication and channels, understandable with a health literacy frame, and essential for appropriate decision making that improves health, so people can make, ultimately also address the autonomy and other issues that are there. This is how we've organized ourselves, and you'll hear from these different groups here today, and we'll hopefully have a discussion amongst that of how these all fit together, because they are all organized. It will be into a final report, so that's what a lot of our sharing of the information, and like Ben, there is no substitute for in-person meetings, and that first in-person meeting that we've had here in Berlin has been incredible in terms of synergizing our efforts. First, understanding the cultural context, and those of you who know Heidi Larson, an anthropologist who is working on this with Raphael Obrecht. Raphael is with UNICEF and led the communication for development work while he was there. We're looking at the media. We're fortunate that Alex Kuzmanovic from WHO, who's one of the #1 leading influencers, at least in the evidence-based scientific world, if I can say that. And if you follow Alex on her, I will let her, you could see plenty of pictures with a number of different people and very well curated information. And the second part of affirming health communication as a distinct discipline also links here for the capacity building that we believe is necessary for people to do wanting good public health, good medicine, good health care, and ultimately good communication. Technology, Carolina Batista, who's an expert in not only the spirit of technology at the local level from her work in Brazil, and she'll be speaking more of her work with D&DI and work in Latin America, but also the importance of how you bring the entrepreneurial impact spirit into the nature of digital health. And we'll talk a little bit more about that. And there, of course, is the important piece that was well mentioned by Catherine Kluver-Ashbrook at the beginning, trust. How do we build trust in the new technologies and the way that we communicate? Fourth, quality itself. How do we define it? We have the definition, but how do we measure it? Health information quality indicators. We're very fortunate. We have 2 commissioners working very well together, co-leading the work of the Health Information Quality Indicator Group. We'll be talking about this. Eric Sutherland from the OECD and Rebecca Evich from University of Alabama. And then finally, the foremost leader in legal scholar and national and global health law, Larry Gostin from O'Neill Institute, not only foremost scholar, but #1 published in terms of his work that he's been doing in this, working not only with the WHO Collaborating Center at Georgetown O'Neill Institute, but also just an incredible partner and co-author and co-chair. So thank you, Larry. So one last slide, and then we're going to be able to get more into a panel discussion. We do have this dynamic political environment that's there, and it threatens science and health as we know it. We believe our commission can work in the center of this to help navigate the challenging healthcare environment. Ultimately, we want to have increased health literacy, which is the center, but we know, if we start in the bottom left, that technology does offer promise, but it also comes with risks. How do we help harness this for quality? How do we harness quality health information in that regard? The top, autonomy. People want control of their health decisions. And we've already started to look at the segmentation of where people live in a a democracy that's working well or a flawed democracy or an autocracy? How do they have decisions about their own health, which some people believe that's the only competent authority for your health is yourself. So how do we deal with those belief systems and so forth? And then prevention and treatment. As global inequity prevails, you don't have to go far from the discussions, whether they're in Geneva, Berlin, New York, on the non-communicable disease situation. We have a pandemic that more than ever has pointed those out, and we still have global inequity. So we think we're in the spot in the middle. There's advocacy, communication, and access. This is not perfect. We can put institutions and people and the different disciplines in different spots here, but we're looking at this as an operating framework and know that there'll be a dynamic political environment. We hope to drive change, and we like to make this transformational. We are trying to reimagine the entire process by which health information is developed, disseminated, understood, and evaluated. On the left are the quality health information metrics, which we already had some preliminary sets and pieces presented to us, outlining steps to enhance trust in health information sources, the source integrity, as we talked about, techniques to improve dissemination of health information, which channels, when are those channels effective, who are the people on those channels, and how are those validated. And it's both a theory and practice here. Propose tactics to mitigate and manage the impact of false or misleading information. We are not focusing on that. We are focusing on building quality health information, but in the political environment, we do have to recognize that that's the case, and what are tactics on the impact of that. Strategies to assess the impact, we need to have that going forward, and the use of AI in health information. And then finally, as mentioned earlier, what is a novel curriculum for health and science communicators? So that's where we are. We're hoping that our commission will be transformative. We have a charge to the commission to have a publication by mid-2027. But along the way, we hope to have, we will have, and already have pieces in progress that are intermediate presentations, evidence that's been gathered, articles that will be published, and ways that we can articulate these, the ideas and gather ideas at both national and global conferences. And I do agree with what Ben's saying. Again, people together in person will make a difference. So know that we're approachable, and know that at the end of this you'll have both some of our direct emails as well as ways to reach us as this commission will slowly develop information that we'll be sharing. But we are going through the peer review process that was well articulated, and the importance of how peer review is still the modern day gold standard, if I can say that, of how information gets published and diffused appropriately. And having said that, we're really proud to be part of the Nature Medicine Commission, and we'll rise to the standards that we all believe are been well published and articulated. So the first two people will be speaking are, as I introduced before, Professor Rebecca Evich and Dr. Eric Sutherland. And we don't have a slide presentation that's going to keep going in this regard, but we do want to show what this group has been doing, because this process does follow an evidence and science-based approach, first with the scoping review, then a computational analysis, expert insights, initial indicators, and then refinement. And Becky and Eric will be talking about where they are in the process and how much this has shown. And I'll let Becky speak to the scoping review as both the lead author on this. And it was a joint effort between doctoral students at both of our institutions, at University of Alabama and CUNY Graduate School of Public Health and Health Policy, but led very much with the rigor. And I'll turn it over when Becky will talk about the evidence of the nearly 9,000 studies that were there, and then the findings and direction. So, Dr. Evich, if you don't mind, I'll let you speak to this slide, even though you don't have it in front. Well, you do have it in front of you. And then I will ask, we're going to have Eric and Becky at the table, and we'll ask some questions and chat.
Sure. Thank you so much, Dr. Ratson, for that. Briefly, I thought I'd begin by discussing a bit on the importance of the work, if that's all right, and what we found roughly with the scoping review and the process that we undertook. So we, as Dr. Ratson pointed out, we have undertaken in roughly a 7 to 8 month period a number of steps to conduct a set of scoping review, computational analyses, network analyses, expert interviews, and pilot study to arrive at a set of preliminary indicator domains. And my colleague, Dr. Eric Sutherland, is here with me to discuss some of that today. And I believe Dr. Ratson is going to ask a few questions on this work. I'm happy to field questions specifically about the methodology, if you'd like to discuss that in further technical detail later. What that process allowed us to do was to understand the landscape of quality health information as it is reported in the last decade of literature in public health, health communication, in medicine, in the peer-reviewed literature, as well as the gray literature as well, reports from the national academies, OECD, other documents, and map the evidence. And what we found, if we go to the next slide, briefly speaking, is that there was really a lack of cumulative science or fragmentation. Essentially, we don't have a global framework of what quality health information is, which is consistent with what we've previously alluded to earlier in today's discussion. We know what quality health information is not. We know that there are a range of indicators, metrics, and models that are used to assess quality. But this tells us that there is a real need for what needs to be done. Our expert interviews also provided us with a sense of what needs to be done in terms of understanding and building trust and building a sense of dimensions in terms of quality health information. I'd also like to point out that in our findings too, we assessed a range of items that we found that our methods, the methods used in a range of studies, found that they were often quantitative, typically used content analyses, but often were limited in terms of depth and exploration. And there was limited scope in terms of qualitative findings. So really listening to the voices of community members and individuals. And we really want to change that in order to build community trust, in order to develop and work with indicators that speak to the voices of everyone globally, and in order to develop a framework that serves the needs of people, which is a very hard task to do, and we know this, and we know this is going to take a long time, but that we really need to work with methods that span the range of that scope, and we're happy to discuss that further. I'd like to pause briefly and ask Eric to offer some insights as well.
My throat got blown out. I was partying on the Bundesstrasse a couple minutes ago. We haven't seen the light show, it's for seeing. In any case, practically speaking, this is about finding a way to quantify, to really make this something that's important to policymakers, important to institutions to invest in that work. Because frankly, we haven't been able to tell the story. We know anecdotally there are problems, but we haven't been able to create the headline statistic, X number of patients die on an annual basis because of misinformation. Or there's a waste of X billion of dollars in health systems budgets because we are dealing with AI slop. And the reality of our situation is there is now more AI slop than there has ever been before. There is going to be more AI slop tomorrow and tomorrow and tomorrow, and it's going to, frankly, exponentially increase. It is going to be harder for us to create the conditions under which that clear signal of what quality health information is going to be incredibly difficult for us to create that. But that is what our challenge is. And a big part of the indicators work that we're coming up with is what are the attributes that people need to understand, to the levers they can pull to find the signal, to identify what the quality health information is. Things like, do I trust this person? Do I trust this institution? Do I trust this platform? Things like, is the message that's being delivered something that is entertaining? Is it something that is, enjoyable to consume? Is it something that is written at a third grade level? These are all attributes of what makes quality health information. Yes, it needs to be scientifically sound, but what we've really discovered is that it takes a lot more than just science carrying the day. And so we absolutely need to find out what the indicators are in order to help pull the levers. But before people are willing to pull the levers, we have to tell the story of the socioeconomic impact of not addressing this massive crisis that we have.
Thank you, Eric. So, Becky, you gave already some ideas on why it's important to have health information equality, HIQIs, where I'll give the first time of the acronym that we'll start to use this, Health Information Quality Indicators. What do you think would be so important about this from your perspective?
Great question, Dr. Ratson. So the reason why this work is vital, if not just absolutely essential, and I see many of my colleagues and collaborators in the room today, so I'm so grateful that you're here. But these indicators are going to help to ensure both quality and accountability. We're talking about the role of trust, and we really absolutely want to build trust. I feel like that's such a key word that we need to work towards. As I mentioned, we don't currently have global frameworks and a global set of indicators towards that. One of the grand challenges that Dr. Johnson mentioned earlier that we've seen in the literature and that we know is that we see that poor quality, misleading information is everywhere, and that we also know that it spreads faster than high quality or reliable information. It tends to be more interesting to people. It tends to be content that, frankly, is just information that spreads rapidly. And therefore, what does that do? That erodes trust. That erodes public trust. Ultimately, we are interested in serving the public. Those are the people that we need to reach with the indicators that we are developing. And we need to benefit public health. We need to benefit the public with this work. And so through conducting a scientific and evidence-based body of work in developing indicators, that will allow us to create and build measurable improvements in the information environment that we live in today.
And just to add on that, I think one of the truly strange things about health, and I say this because I was in banking for 20 years before I joined health about 10 years ago, I find it strange that we don't prioritize asking the people that we're meaning to serve, what is it that we would do? What is it that they would like to see? And by they, I mean the public. What is it the public expects? How is it that they consume quality health information? What is the attributes that are most important to them? Because then if we listen to them and we embody those things, then we're building that trustworthiness cycle between us and the communicators and the communicatees. Too often, I think that we have said, trust me, yelling from the mountaintop. And that is the worst way to earn trust. The best way to earn trust and be trustworthy is be humble and ask. And then you create the virtuous cycle of trustworthiness, which is essential if we want to address, as I said, our AI slop. I just enjoy saying AI slop.
So as both of you have been looking at this, and Eric, you come from an organization, the OECD, that has deep history in not only the quantitative nature, the economic nature, of course, but in developing indicators. So what has been done thus far in this regard that relates to the work of our commission?
Well, historically speaking, like the OECD is a very, for those who don't know, a broad organization that addresses all parts of the economy across 38 countries, although we have partnerships with many others, including the African Union, China, India, et cetera. And we have many other countries in Latin America and Southeast Asia that we're partnering with as well. And within that, we do analysis both horizontally, for example, AI principles first came out in 2019, but then also vertically, we dive into specific areas around health. We have one of our focus areas is around public health specifically, and within that, we've done a lot of analysis around what are the opportunities for prevention. We've done a lot of work around obesity campaigns and the cost of obesity, the value of nutrition labels on cans and things like that. So we've done a lot of those types of analyses. What we believe we can do now more than believe. What we know we can do is to take those analyses that we've done and pre-parameterize and design those in order to help answer this question about what are both the people impacts and the economic impacts of the either the benefit of quality health information or more likely the opportunity cost from not amplifying quality health information.
Well, we know that's a big task, and I'm glad you're moving from I believe that I know. So we have the at least the methodologies. So how do you think this is all going to evolve in terms of the work of the commission? I'm looking at both of you, doctors, as I may say.
Well, right now we have a set of preliminary indicators, and those look currently at the role of distribution and moderation of content, the role of provenance or disclosure of authorship, for instance, health literacy, cultural relevance, and engagement. And we, I think, anticipate those are going to change. We're going to undergo global testing in a number of countries, LMICs, HICs, and other emerging economies. Those are likely going to evolve, and likely they should, as I mentioned earlier, that while we're going to undergo additional surveys over the year, we're also going to be gaining qualitative insight as well, so that we listen to the voices of communities, certainly additional computational analyses, and developing further models. We're going to be working on a number of insights to understand additional nuances within those domains to get a sense of and ensure that these domains capture what quality health information indicators truly need to encapsulate. And so that is where we anticipate that work is going to go.
And just to add on that, Becky, that I think that the end outcome of this work is going to be how do we better get the attention of our policymakers that this is an area in which they should invest. Where they should invest is in better health communication, better training for our people to actually better communicate with the public, and better assessment with the public about what it is in terms of our playbooks about how to communicate more effectively. And some of that will be, I'll say, tuned a little bit, because communication in times of crisis may be different than in times of normalcy. And so I think that's where we also have opportunities to learn what are some of these indicators that or some of these levers we want to pull at different points in time to be most impactful with our communications, and then set up messaging or set up our indicators such that we can measure the impact of our communications in an effective and sustained way.
And just to build off of that, I think, Eric, you did a great job of outlining that. That helps to create transparency for the public. If we do this right, and I think we're on the right path, but that creates that transparency that we need. And we intend to make sure this goes out to the public. And that this information gets to the people. We want to reach people at a variety of literacy levels, at a variety of capacities, those that are in multiple communities around the world. And so we really want to create a shared sense of responsibility to build trust, and so that we reach everyone in this way.
So as you can see, there's a lot of great work and great thinking and great experience that both Dr. Sutherland and Dr. Eavis bring to this. I would say that I'm very enthusiastic about what we've seen thus far, and our commissioners, I should mention over 20, have seen this and already have begun to mention both the importance and, as we refine this process, how it will fit in the world that we live in today, and the forward-thinking nature of this commission as well. And we couldn't be forward-thinking without addressing probably I shouldn't say the most important challenge every day in and day out of our time with the speed and content with AI and digital technologies. We did put very specifically in there, and building trust. So again, appreciate the thinking that almost everyone has said here. Why transparency on our methods and our processes? Because transparency also builds trust. We need to also, it offers the opportunity for people to understand what we're doing and why we're doing it. And that's why, one of the reasons why we have this session here today. With that, I'm going to turn it over to Dr. Carolina Batista. Again, she's a co-chair with the commission and has been involved since the beginning. Even there's a lot of work that went in from when Ben mentioned when we started in 2024 to Larry and I and others in both Geneva, Carolina and I at OECD in Paris, And many of us have continued to be out in the world and listen. And I think Carolina brings a very great perspective, which makes us multidisciplinary and on target in the science-based approach. Over to you, Carolina.
So thank you, Scott, and thanks everyone for being here. So maybe before I start, I just want to ask everyone in the room who has ever asked Google or gone on a search engine to ask a question about health. Oh, okay. So who wears any device, any wearable device, whether it's an Apple Watch or any watch or a ring that will give you some information on how you sleep, your heart rate? No, don't lie. Yes. Okay. Well, more than I thought. I also do. I have a fancy watch today, but I usually have my other one. Yeah, so I think it's clear digital platforms are now the default source for health information in most of the world. According to the World Health Organization, over 70% of the people all over the world go online to search for health information, health-related information. And of course, generative AI systems are very rapidly influencing how people get the information on health that they get. And of course, we know that, as we said before, Eric said, I love it, I'm going to quote that now, the AI slop. It's really, there's no validation, right? So we know that the data often is built on people that don't represent the people who are searching for data. I come from Brazil. I'm sure a lot of the data that people consume there were derived from someone in I don't know, rural Montana that doesn't really represent what they're searching in terms of information. Of course, also, we don't need to go far. We all received a WhatsApp message or we saw something on our social media around COVID, but then now more and more on bad quality information, right? Misinformation, disinformation, fake news. So I think we really are facing a big issue now that's been amplified by AI capacity and these virality loops, right? That you go and you click on a fake information and it just, your feed becomes filled with that, right? Your screen gets almost infected. And as an infectious disease physician myself, I always try to make a connection of, like, how can we make it almost like an analogy between, how virus spread, how epidemics happen, how outbreaks happen, and how, we can infect, and there have been some very interesting studies on that, how you can actually inoculate that information, and people have been able to follow, almost like you follow a virus. So we're really having some interesting discussions on, is there a role for us to play with all of these amazing AI tools that exist now and have been badly used, if I may say, being very nice? How can we use them? How can we leverage them to generate good quality information and inoculate in a way, right? Using that analogy, but also, thinking that the name of the commission is Quality Health Information for All. So I think that's also a very important issue, is to be a commission that speaks to all, to everyone, to someone. I had a great breakfast today, discussion on digital health and AI. Now, there were some great people from Ghana, from Rwanda, from Nigeria. How can we make sure that these people have the trust in the data that they're providing, right, to the digital health tools that they're using now to get, reminders on vaccination or, on nutrition. So all of that, I think we have to be really, and I always try to remind ourselves it's information for all, and for all needs to be equity by design, not something that we think after, and that has to be also translated in the work we're doing in the commission. And of course, this, just to say that this, the access to the information through AI and digital tools remain uneven, right? Some people have access to good quality information. Some people get, information that has been translated several times. And being from Brazil myself, I'm sure a lot of the information that people in my own country receive has been translated so many times. And we all had, situations that our conversations have been lost in translation. So how much of that also relates and translates into what people are consuming in terms of health information? And then I think that the fact that the rapid adoption of AI-driven and digital health tools all over the world, but mostly and particularly, and this is my day-to-day job at Baraka, we work with entrepreneurs that are really trying to bridge, the infrastructural gaps on health in low-middle income countries. There are only so many hospitals you can build in a few years. There are only so many physicians, nurses, midwives you can train with, with the resources that people have, with the time they have. So we're seeing that digital health tools are flooding everywhere, but especially low-middle income countries. So how can we leverage these tools in a way that they're the ones also harnessing these types of information, and also in a way that people trust them, because oftentimes they don't have the choice to go to another source of health. So how can we use those tools? How can we leverage them? And when I talk to entrepreneurs, I can say for sure, they want to do good. They want to do good. They want to do well. So let's try to leverage that as well. And then just to say that our vision with this working group, and it's a very transversal working group, right? Because it has to do with the social media. It has to do, with what Eric and Rebecca were saying. How can we make people trust the information that they're seeing, they're reading? How can we create a seal of quality, if we can say so? But how can we develop this frame that is developed with the people, for the people, not just we develop here, from an amazing journal, but also how can we engage the people developing them so that they're easy to adopt, they go as fast, and as Eric also says always, we have to ensure that AI is adopted fast but responsibly, right, without doing harm, and I think we have to keep that, and that's the goal that we want to achieve with this working group in the Commission.
Thank you so much, Dr. Batista. We've been fortunate to have your both clinical background, your background not only in Brazil and Latin America, but also your global reach and thinking of the new technologies. Let me also mention that this is at work also with Alain Lebrique from WHO, who couldn't be at the session today as one of our commissioners, and how we're looking deeply with his unit of both data and cases that they have. And part of what may likely be in the final report will be some curated case studies on the kind of work that's been out there that's been both successful and perhaps also has some challenges. So we've heard already of some ideas. I don't want to get ahead of us in specific of which ones they may be, but we do know that there's a wide array of data and information and evidence that is not currently in the public domain. With that, I was thinking about, we were talking about virus. We want things to go viral, which is a term that we use. And another time, we want antivirus software. So I don't know what the outcome is going to be other than looking at our chief influencer who reminds us of the world that we live in, not the world as we thought it may be. Alex Kuzmanovic has just been terrific. We have used and published legacy media. I know some of people are not happy to see that, but that's actually, we say that there's traditional and legacy media. And I could say, I could say, unfortunately, from somebody who still reads legacy media on print, as newspapers closing around the world and the consolidation, the world is definitely changing in this regard. But we do have legacy media commissioners, and we do have digital and social media experts, as well as ways that we could ascertain this amongst the environment. So Alex is going to speak eloquently, as she always does, on her perspective on what is most important about this working group.
Thank you very much, Scott. So I'm getting red a bit with this intro. I'm really honored to have the chance to co-lead this working group on legacy, social, and digital media with Scott and Becky, and also to have the privilege to recruit health practitioners, communication practitioners who will be supporting us in the work of the Commission, because if we talk about building trust and communicating science and health information, communication practitioners are the key bridge between the scientists and the public. And from experience on digital communication, we actually function a lot on a trial and error basis because the digital environment is so fast, and many health institutions don't have enough resources and capacities to keep up with this digital first trend that we are seeing that is taking over basically information space. Some other challenges, as my colleagues have mentioned, is mis and disinformation, but still the biggest problem, what Ben actually reminded us a few days ago at the meeting, is that our objective is to improve day-to-day access to quality health information to people. And he spoke a bit about that today. So other challenges that we are facing is that trust is shifting from institutions to individuals. So traditionally, as we look into ministries of health or institutes of public health as the first source of information, now we see that it's actually influencers. And it's very hard to assess in this ocean of digital content who is a trustworthy influencer or content creator that we should trust when it comes to health information. I believe that is important actually for health experts, medical doctors, nurses, and those who have actually real health knowledge to also take on more on a health communicator's role. So with our working group, as Scott mentioned, we will focus on hopefully developing some principles on how to develop quality health content, but also to identify what are the skills that health communicators, whether they are behind institutional or individual accounts, should have, so that they can produce that content that will be relevant in 2030s. Because as Scott mentioned, this report is going to come in 2027. No commission report was, I think, implemented immediately. So I think that we really need to think forward with the speed of digital technologies that are developing, how we're going to be relevant in the next decade. So how are we going to do this? As Becky and Eric spoke, they looked into literature review on quality indicators, etc. When it comes to practice of health communication, we want to build that evidence in media and legacy media and digital media environment. So we're going to do assessment from 2015 to 2025 on legacy media coverage of health, pre-COVID, during COVID, post-COVID, because we've observed that this has changed and which type of reporters have introduced writing about health in comparison to pre-pandemic, so that we can provide some principles how health practitioners can approach legacy media for better quality content. We will try to do the same reflection on digital environment. We do have a lot of reports on how digital, and we are witnessing it, we're living it every day, how digital environment is evolving, but we don't know how much digital attention health content is receiving. So we will try to assess where health fits in there in this digital evolution and how we are meeting those digital trends. And last but not least, we will try to do assessment on health communication capacities in countries so that we can see, are we matched with where the trends of communication environment are going with the skills that we have in the sector. So based on that, we will hopefully develop some guidance on the curriculum and capacity building so that our health communicators can be fit for purpose for the future generations and future health threats. Thank you very much.
Well, thank you, Alex. Very well articulated that we're both retrospectively learning from a decade of experience and having access, and also with our big, whether it's large language models, big computational analyses and so forth, to look at that, but also assessing the capacity building in the capacity in country. You know, notwithstanding, we've had some of the diminution of that, of our global health units. There's probably discussion throughout this whole session, right? Whether it's a multilateral institution or even the bilateral institutions, or those who you may have been involved in technical assistance, or all the different parts in how we have been diffusing health. With that, we have, again, our leading global scholar who, you know, has not only written on the pandemic treaty, engaged in discussions at all sorts of levels on where we are in the global health world, and has helped from the very beginning, from when we met both with Ben and the World Health Organization leaders in Geneva, the importance of why quality health information now is more important than ever. So Larry is always prescient, if I can say that, but also will give us an overview from his perspective.
Thanks very much. What I want to do is, I'm supposed to summarize. It's very difficult to do that. But I want to begin with some words of gratitude. You know, first, of course, to Scott for really leading this, and to my fellow commissioners and co-chairs. It's really been an honor. to Bertelsmann, who's been so amazing. Thank you, Catherine. The Nature Portfolio, Ben, Sarah Tomlin is with us. And I just also might add WHO with Alex here, but also Tedros. Tedros and I go back so many years, and whenever we talk, we show each other pictures of our grandchildren. And I think that's what we're doing this for. We're doing it for our grandchildren who are growing up in a world that is so confusing, so dizzying, so disruptive, so disorienting, that we really owe it to them. So I'll want to talk about quickly 4 things. The first is, why does this matter? The second is, what are the principles and values that we should use to organize our way of thinking about this? And I'll be talking a lot about good governance and democratic values and human rights. All are extraordinarily important. Third, I want to explain why that you've come to the right session. There is literally nothing more important to the future of our humanity than trust and health information. Nothing more important. And then finally, there's nothing harder. Nothing, that seems so insurmountable, which is why I'm really glad that we have all of our friends and colleagues that are truly trying to work on this. So, why it matters. I think of this in terms of, people, communities, trust, equity and justice, and science. Really important issues that really engage our day. This is important to every individual, every human being on the planet. We've heard from our panelists about how patients get their information in clinical settings. Mothers throughout the world in every region are looking for the best information to keep their families, healthy and strong and have mental and well-being, and also for the most vulnerable among us to have access to information. So it matters on a purely individual human level. But it also, I think, matters to families, communities, and to all of society, particularly in the West, but not exclusively, but I think particularly in the West, and even more particularly in my country. We spend so much time thinking about me. What does government, what do others owe me? And we've lost this tradition of the common good. What do I owe to my family, my neighbors, my community, my country, my world? Extraordinarily important value of we're all in this together and we're all suffering from the same cacophony of information that's bombarding us. Third is, of course, trust and trustworthiness. Eric and Rebecca talked about this. And trust is a very important concept, but also those communicators need to be trustworthy. And that involves, yes, humbleness, sincerity. It involves caring, loving, honesty, integrity. And I do believe that the public can understand when they see authenticity and sincerity. I think that is at the heart of trust, is that caring and authenticity that that the public is yearning for, and they're not finding it in a lot of places, and particularly in government.
one thing that's near to my heart, there are two things that have always been near to my heart, health and justice. And you can have health without justice, and you can have justice without health, but we need both. Information has to be accessible for all. And that's why we have for all, and it's a title to our commission. There needs to be equitable access to this information so that every human being on the planet can have access to evidence-based, thoughtful, clear, engaging information. And then another reason why it's important, and I thought I would never have to say this, but coming from the States, I actually have to, is science itself. Science itself is under enormous pressure at the moment. There is no truth. COVID has, brought the world. You would have thought that if we had all been in a pandemic together, it would bring us together. And, I always wondered, because I've been in public and global health pretty much all my life since I was very young, and I'm not very young anymore. And I always imagined, what would it be like to live in a pandemic? I read about the 1918 flu pandemic, and then it came, and we were all scared, and there were body bags and floating hospitals and, panic. We would see people on, breathing machines, and we didn't know, we had no vaccines, we had no drugs, we didn't know. That should have brought us together. It seems to have ripped us apart. I don't know why, and it's still doing it to this very day. So that's why it matters. We need to approach this from the principles of good governance. Transparency, accountability, and most of all, human rights and the right to health. And I think of human rights and the right to health in two ways. Again, it's the right of individuals. Think about health information privacy, integrity, data security, and things like that. But to me, the right to health is also the right for healthy communities, healthy populations. And I think we need to think of our project together as creating the conditions for healthy people everywhere as very important. And this also means things like, freedom of expression and, people's ability to flourish, and that we don't talk down to them and think that we know things better, that we're humble. I think the third thing is really what I kind of have been thinking about a long time, which is, what we're doing in this room together is really important. Because in so many ways, you think of information maybe in a clinical setting, but people don't get it. And they don't even get it by searching Google. They get it because their feeds are coming, and it's constantly, they can't separate good information from bad information. I have so many friends around the world, and everybody has this challenge. And, even while I've been here, people have been, texting me and say, why don't you try this? You've been traveling and you're working so hard, Larry. Why don't you try this? And because some social influencer has told them to. So I don't know why anybody would listen to an influencer unless it's Alex. This is really important. It's really hard. And it's hard because of this cacophony of information. And how do we separate it? And it's not going to get any easier, because all of this is going to be amplified through artificial intelligence and other digital technologies that will only make it harder to differentiate the true from the not true, no matter where it's coming from. And so I've been, coming from the United States, it's very embarrassing what's going on there. And, So I would say my final messages would be, and this is what I've been working on: stand up for science, stand up for integrity, stand up for trust, and stand up for health information, equity, caring, compassion, and love. If we can do that, society might just win. I don't know.
Thank you, Larry. Yes, it is hard. And we have, I think, one of the best professors in the world to remind us of that. But let me also say that it's clear that this cannot be tackled alone from within the scientific endeavor, nor necessarily the social science, nor necessarily legal, nor necessarily all of our fields. We need to figure out a way that we can harness the differentiated thinking and training. I mean, I come first trained as a physician and then degrees in government and public administration, communication, and I go back to rhetoric, and I keep thinking more and more about it, the trust and the integrity that Larry spoke about, and hearing some of those things and ideas at this conference are hopefully, as I say, as Larry said, he was not alive in 1918, but had studied it. I say sometimes last century, it makes me feel older, but when I look around the room, it is for our grandchildren, and hopefully our grandchildren's grandchildren, if we would think like some of the Native or indigenous folks in many parts of the world. That's how they think, rather than some of our quarterly approaches that we often have in our modern day environment. But I don't want to go too far off the evidence piece and what we need to be doing. We have, I had mentioned our panelists a minute or so each of their thoughts on each other's pieces. And then, I haven't done the full introduction. The bios are clearly on the website with the World Health Summit and clickable, but also in her own expertise, Catherine Kluver-Ashbeck also will give a perspective from her side. And I say that because we have a political scientist on our commission, and we need people with other backgrounds and, again, other disciplines to bring this forward. So Catherine will do one of the wrap-up, and then I'm just going to remind that there's also a written piece in the Health of Political Choice at page 84 about our commission, why it's more important than ever, which is the World Health Summit publication. But with that, I'm going to let Ben go first. We'll kind of go in the reverse order of on what his thoughts are at this point. And from there.
Thanks, Scott. This is great because there's no risk of somebody else saying what I was going to say. So, although I have to think very quickly, but I was actually reflecting. I mean, I think the challenge is huge, but I'm very enthused by the number of people in this room. And I don't know if it's because I'm getting old or it's because I'm tired, but everyone looks very young in the audience. And I'm very excited by that because I think we need solutions that work for the next generation, and we need solutions that are sustainable and work for younger people. So if you're not already involved with the Commission, please do get involved. And we're constantly thinking, how do we involve younger people? Alex is young, but none of the rest of us are. So I look young, but I'm not. So I think that's I think something we would love your help in, is how to make sure that this is future-proof and how to involve the next generation of scientists, communicators, and the public.
Thank you, Ben. I guess it's all a perspective of where the definition of youth or young is.
It certainly is.
But we are enthusiastic to future-proof this, so we do need multiple ideas. So thank you for that. I'll go over to Eric, if I may first, please. If you want
Sure. Still, I am just honestly hearing Larry's talk in particular. When I was reflecting on my own comments earlier on, I thought about, like, am I going over the top by saying this is really, really like an existential type problem? But really, yes. And so to me, like, this is why I changed from finance many years ago to do something meaningful where the work that I do has direct benefit to human beings. And so, like, this is a way of manifesting it, and it is really, I think, incredibly important for us to be working together on this because, like everything, we're only as good as our partners, and we're only as good as every person who's listening. And frankly, we're working this out. I think also, as Scott said earlier on, it's hard. We're not going to get it right the first time. Give us feedback. Talk to us what's going on. Identify what the problems are that are out there. Communicate, and because we are better with this together.
Thank you, Eric. And yes, it is an iterative process, and we will continue to update. This will be, while it will be a print document in the end, it will be a living document as well, as we know the dynamic nature. And we will take that advice, and that's where we have multiple perspectives and your expertise. And I'll continue on with Becky, please.
Okay. So first of all, I'd like to echo a couple of things that Larry said that I think are really important, is that I'd like to offer a lot of thanks, because this work is not possible without having people who are invested in this work. It's really hard work. It's really difficult, and I'm honestly really grateful to be part of something that so many people believe in. And developing these indicators is not possible without working with every single person here, without having people who are interested in this. And I'm grateful, for instance, that knowing that the Bertelsmann Stiftung has an interest in applying this to InfoCure, and I'm grateful to the opportunity to work with Nature Medicine and Nature Health and so many others in this space today that are collaborators. And I invite anyone who's interested to please come talk with us and engage with us on that. And we're doing this, I think, we're doing this for tomorrow and for every person in this room. And so this is, it's difficult. We aren't going to get it right the first time. That's why, these are preliminary work that we're doing, but we hope to. And we can do this if we work together. Thank you so much.
Thank you. It's great to see the work from the indicators, as you saw on the left to right, was important and foundational with both scoping and understanding the literature, helping inform our definition and informing the work of both the Carolina's working group, Alex, and all of ours. And we'll have, as we're integrating this, we've been grateful also by the work with your team. And I know you have a couple of people here from Switzerland, Carium, and others who I can't recognize everyone who's in the room, but I know you've been very collaborative in that regard. Carolina, thanks.
Yes, well, I'm towards the end, so I don't have much to add on that, but just to maybe echo what Sebastian said some few days ago. It seems like a long time because we've had very intense days, but we were at the Bertelsmann Foundation beautiful office, and when we were starting, I think the first day, Sebastian said something, we're building a movement here, right? And I think that's what we're doing. We're really building a movement here, much more so than just, the work of the commission is so important, but it is a movement, and I hope it's a movement rooted in equity, rooted in, the values of human rights. Everyone should have the right to have access to that. And yes, and I'm very inspired by also the people I see in the room and the nods that everyone is. So I hope we can transform that and really, use that as fuel for this movement that we are creating. And the movement is not done alone. We should all be together, and I think we're in the best of companies to have this movement move forward. Thank you.
Thank you, Carolina. The movement piece is just reminds me of all of the strength, as you say, building this together. But are we true believers? And I think Larry and Alex have articulated that so well of what we believe what we're doing. So, Alex, your reflections.
Well, speaking about youth and some of us who are less youth, and all the challenges that digital technologies are posing for us in global health, I am a believer that digital technologies do offer us opportunity to improve health equity, and in particular, health information equity. But digital technologies have also forced us to work more intergenerationally, because younger generations are natively literate, and I actually made my WHO career out of it. I'm not having a background in health, and I don't have background in communications. But 10 years ago, I started as a communications intern, and everything digital, even making slides or downloading a PDF document, came to me. That led to my first contract, and for those familiar with the UN and WHO, many contracts. And I came with the brilliant idea to introduce social media account in our department because I knew that will secure my contract. A few years later, I got an offer to move to Department of Communications. And on my first day, I was told I will be supporting Dr. Tedros, among other tasks. I had no idea where that will lead me. That led me to lead the WHO's social media response during COVID, to be in the room with all kinds of world leaders, to be developing what digital diplomacy means for WHO and our leadership. And that led me to be part of this commission. So digital technologies do offer a lot of opportunities for young people, and those, I'm not that young anymore. You can see if I'm in 10 years in WHO, to be actually part of shaping how the future global health will look like. And because as we are getting older and new tools and platforms are coming, you will be showing us how we can use it better. So, as it was said, please tell us what we can do better, provide feedback, ideas. We are really open and inclusive group of commissioners to try our best. Thank you.
Thank you, Alex. Larry, I'm still going to give you a chance if you have any other reflection here, despite your amazing.
Well, there's youth and there's not youth, so I'm the not youth. I don't know. I mean, one of the things that I really believe in very strongly is to get out of the way and let the younger generation do the leading. And I think what you've heard from all of us is that this is really important for younger generations. You know, you don't have to be young to see how consuming social media technology is for our young generations. Sometimes it is empowering and ennobling, and sometimes it's mind-crushing, and it causes enormous mental distress. So our challenge is to harness the technology for human flourishing, and to try to avoid its harms. And that's enormously difficult in a complex democratic society for many reasons that I won't go into now, but we will in our report.
Mm-hmm. Thank you, Larry. And as I believe we want to do no harm and want to figure out how we can advance quality health information for all. So let me just say that Alex well said that we're still welcoming information, because some people come up and say, well, you didn't see this report or this piece is out there. We did have an academic analysis led by my colleague Rachel Pilch-Loeb presented to the commission with former colleagues at Harvard looking at the 10 National Academies of Science and Engineering and Medicine reports on health literacy or communication or other pieces that might give us some glimpse of what the thinking was, frankly, mostly from a U.S. perspective. We've identified many gaps that were there, and that's been presented, and why our commission is more important than ever, I think, as Larry has said. And from both of us being on the board of global health there, we know that there are gaps by all means. So we're doing our best to get that kind of literature, and as Dr. Evich said earlier, the gray literature is often called, of those kind of reports. Reports don't always have to be written. We do want to try to capture narrative. We do want to capture work that's not in English or German. So we have to figure out ways to do that. It's not easy, but we want to be open to try to do that, as well as the youth perspective from not only the WHO Youth Council that I know is here, but amongst others. So I'm going to stop and give the final floor back to Catherine Krieger-Ashbrook and say just how thankful we are from the ability to be standing here today and talking about this important subject, to be able to have had now 4 days of really focusing on the work here, including the State Secretary, Parliamentary State Secretary for Health, who joined us at the Bertelsmann Foundation offices. We also were fortunate to have interaction not only with European Commission members, but other global folks who had ideas over a moderated dinner. So we are, yes, sitting around the traditional table, but we're open to figuring out all sorts of ways to do that. And with the digital technologies, we should be able to do something transformational. So I want to thank, again, Ben Johnson, Sarah Tallman for both Nature Health and Nature Medicine, respectively. And if anything you'd like to say or ask us at this point, we certainly will have this opportunity. We'll stick around, and you do have some of our email addresses, but we'll also figure out a way, both with the following the summit, to get the information out. Not only this that's on YouTube and otherwise. But with that, I'll turn it back over to Catherine.
Well, the problem you get and have when you ask a political scientist to round things out is, of course, I'm going to talk about power, because that's what I get paid for. You know, I thought this was such a remarkable gathering because, as Ben reminded us early, that health information, or their lack thereof, has been weaponized for power since the dawn of time. And we find ourselves at a moment that, you know, Martin Luther King Jr. coined for the civil rights movement, but this idea that we are in a fierce urgency of now. And we are in this fierce urgency because everything has accelerated in a way that I don't think many of us in this room will have anticipated, particularly for this field, frankly. And I want to remind you that the other side, quote unquote, the side that seeks to divide us, the side that seeks to do all of the opposite pieces that Larry reminded us of, which is the redefinition I spoke about of compassion, the taking away of human empathy, the degrading of our joint humanity, they have not rested. They have used the time in which we assumed that to be a contiguous part of who we are as human beings. They have taken that time to get ready to use weaponization of every source of information for their purposes of building their power. Those are very myopic, small-minded towers of power, and hence we collectively cannot allow those to be. And I was reminded very much when Carolina was talking about things, you know, and just how quickly this has advanced. I used to work for the mayor of New York City, Mayor Michael Bloomberg, in his second administration. I was charged with trying to help 1.8 million New Yorkers who are limited English proficiency speakers get the kind of vital information they would need to be good citizens, to be good stewards in their interaction with the city, and vice versa, to fulfill the promises of civic engagement. And that was so true around things like anthrax, for instance, at the time. And the things that I could review, one of the main languages at the time, of course, it was Haitian Creole in the city of New York, which still is. And if you miss a negation or two in there, people are going to come looking for their diabetes medicine in places where they're not supposed to be come looking for them. And then you have another sort of knock-on public policy crisis. So that has just exacerbated and accelerated. And the fact that the other side has realized very quickly where cohesion in our community lies has centered around families and mothers as replicators of information, whether it's true or not, gives us the impetus to look further, and all the panelists have mentioned where we need to look. I will give the panel as well that one place that we need to seek that connection between the digital space and the human space is, of course, where we still find trust, which is in our civic engagement within our cities. The places that we still trust fundamentally are our mayors. They're in our neighborhoods. They're in the lived community that takes us away from the screen, even though the screen now offers so much. We're proud to support this idea. My colleagues Sebastian Schmidt-Kehler, Dr. Sebastian Schmidt-Kehler and Malte Etienne are here in this endeavor by piloting InfoCure, an idea that where the rest of the world has decided to put health and human thriving, put profit over health and human thriving by getting rid of fact-checking, by getting rid of things that would have equalized this idea of power online. We want to stand up for that. We want to do that with our InfoCure initiative so that we bring what is done here in this group in a certification process in a way that you will be able to access certified public health information for you, for your sake, online. I just think it's such a valid endeavor to bring together social psychology, behavioral psychology, knowing what we know about humans and how they behave around information, especially when it's so vital to our joint human thriving. So I'm so glad that all of you are here using your power of proximity to be with one another in community, to reinforce the goals of this commission. I want to thank you for your dedication and work and let you know that we, as the third sector, as part of the third sector in Germany, but working internationally, stand ready to do our work as public health professionals, as public policy professionals, but fundamentally, as Larry pointed out, as compassionate individuals, as compassionate, empathetic human beings. So thanks for being here. Have a great rest of your summit, and I do hope you engage very intently with the work of the Commission.
Thanks to everyone here. This concludes our session, and we'll see you at the summit.